couple of things to cover today. I thought that were interesting studies that came out over the last couple of weeks that helped to provide additional insight. One was this large meta-analysis of many studies that have looked at household transmission rates over the course of the pandemic. And this has yielded, not surprisingly, similar results to what we've seen published in previous literature. So, essentially looked at several dozen, actually over 50 studies that looked at household transmission. And you can see there, if you can look microscopically on the left, that's all of the studies and the mean and the range of household transmission estimates. But down at the bottom is the important number with the red arrow, and that's the combined total estimate of about 17% household transmission rate. So it means if there's an initial index case in a household, about 17% of household contacts become infected. I think the important thing to note is that for many of these studies, household transmission was documented by symptoms, and so symptomatic disease leading to somebody being tested, rather than a minority of them which looked at PCR testing in all household contexts. So there's probably some ascertainment bias here that misses quite a few people who are contacts who develop disease but don't necessarily develop symptoms. And I think that's highlighted by a study that came out actually last month, but hadn't talked about it yet. And that's the CDC and Vanderbilt project that looked at household transmission surveillance in Tennessee and Wisconsin. And what they did is followed roughly 100 index patients, 101, and then looked at 191 household members of those index patients to see what the transmission rate was. Interestingly, if you look at the index patients, it was a pretty broad representation of ages. So as you can see, 33% were under the age of 18, so a pretty good representation of kids in that group. And if you look at contacts, first of all, the interesting thing is that a much higher rate of contact infection, household contact infection, than seen in many of those previous studies included in the meta-analysis. And part of this is because they did PCR on every household contact every day for 14 days. And these data are actually reported only from the first 7 days. So that's probably one explanation, is when you actually look, you find more infections because many of them were asymptomatic. Again, if you look, 60% of those cases, all cases, were asymptomatic at the time of detection, and a third remained completely asymptomatic for the entire period of the study. And then the other thing to note there is that if you look at index patients under the age of 12, the household transmission rate did not seem to vary. And so really across all of the age groups, there didn't seem to be one age group that was better at transmitting to household contacts or one age group that seemed to be less likely to transmit. And so again, I think this highlights probably some of the facts that we miss transmission from kids and between kids because we don't look and because they're generally asymptomatic. I think the second study that came out recently that I thought was good to highlight, and this has gained some recognition in the lay press, was this analysis of several cases in a restaurant in Korea. Again, Korea has a tremendously well-developed public health system and is able to do really detailed contact tracing. And this incidence was in this restaurant was important because if you see this one index case, which is termed case B here, was able to infect 2 other folks in the restaurant at a relatively long distance and with a relatively short exposure time. So you can see on the right, this is a diagram of the restaurant with those dashed boxes being the air outflow ducts from the ceiling, and the arrows representing airflow, in the room. And what you can see is where that person B was, and where the 2 downstream exposed and infected people were is a direct line airflow at the confluence of the two flows from those two ducts. And so you have a pretty straight diagonal consistent flow, and you can see about 3 feet per second was the velocity of airflow there. And what happened is those two people, even with a short exposure time of 5 minutes in one case, and over the distance of, the shortest was 4.8 meters, right? So that's over 15 feet. Those two were able to be infected in a restaurant setting. Again, just demonstrating that in an indoor environment, especially where people are unmasked, you can have significant exposures even in short periods of time. So I think highlights again the risk that we've been pointing out about indoor dining and indoor places in general, where people are congregated and aren't wearing masks. And again, there's nothing magic about the 15-minute rule. There's nothing magic about 6 feet. Those are just general rules of thumb that are really based on different transmission scenarios. But in general, are if you have to choose some arbitrary guideline, people have gravitated towards those. But again, plenty of situations where those two metrics are completely insufficient. And that's particularly true indoors without masks and in places where there's potentially longer periods of exposure. So those are the two things I wanted to highlight, and we'll stop and answer any questions there.